As physios, we have to navigate the healthcare system.
We have to deal with insurance adjusters, physicians.
We're not always being appreciated for what we can bring to the table.
Increases are not happening, margins are tight.
There is that unconscious divide between private and public settings. You do feel isolated.
Depending on my schedule, I can see up to 14 patients a day. So it could be very, very tiring.
As physios, we often feel like we're undervalued. We were working hard during COVID, but weren't rewarded.
Where do we sit? Where do we stand? Where do we assert ourselves?
For wages in public side, there's so much discrepancy between cities.
Minutia and administrative burden of billing.
We have to stay up to date on clinical practice guidelines, on funding models. We have to be change makers to adapt to the needs of the system and the needs of our patients, and to collaborate with each other to drive our profession and healthcare forward in Ontario.
So many PTs may not realize that this is a time of disruptive change for us.
You want to be proud of your profession, and then to be proud of your profession, you want to see progress. We need advocacy.
Clinical care is evolving. Technology is changing. Science is changing. That if we don't have the researchers, if we don't have the teachers, if we don't have the entrepreneurs, if we don't have the clinicians, our profession becomes actually kind of two-dimensional.
We have the opportunity to make progress, but we run the risk of not keeping pace, especially compared to other professions, if we're sitting on the sidelines.
But many PTs may not realize that there's a really strong group who are advocating on their behalf, supporting them in a one-on-one situation where they need assistance, supporting them at ministry tables and conversations with insurance companies and other key players that impact things such as scope of practice, that impact salary and reimbursement models.
Even though we're not your bargaining agent, we certainly are your advocate. You are part of a family of physiotherapists that actually really are interested in the growth and advancement of the profession overall, whether that's nationally, whether it's provincially, or whether it's locally. The college's job is to regulate members. That's not our job. The OPA's job is to engage members, to advocate, to educate, to advance issues that really matter to members. And that's going to be fees, participation in the system, and equity and access.
While you're focused on day-to-day things, running your practice, clients, life, family, we're focused on the really important things that are going to make those easier for you to do. Compensation, scope of practice, advocacy at a number of different levels.
Members who have been there for like years and years, they have that passion that there's change that's going to happen. They believe in it, and that's why they're there. That's why they're showing up.
You know, we have a modest budget, we have a small staff, but we continue to be really focused on what matters, the priorities of the profession, the things that we think are going to get us more and further and faster and better.
There are times when, through advocacy, things don't move as quickly. We make things move with the team that we have, and we make things move much faster considering the size of the team that we have. As president, I'm very proud that we're able to make the changes we've been able to make, considering we are a small but mighty group.
The board of directors of the OPA is made up entirely of physiotherapists, and that means that the leadership and the vision and the strategic planning and the movement forward is coming from the voices of physiotherapists within our province.
I honestly believe that it's thanks to the PTs of the past and where they've supported the association through their membership and their involvement that we are doing things that we didn't do before. We weren't in family health clinics before. We weren't providing care in such manners. We weren't part of integrated care teams. We weren't doing advanced practice models. And all of that has been supported by the work of physios of the past who, as members and supporting the association, have helped drive the voice to get us there.
Being able to look around and see the changes that are happening and the opportunity for you to affect change is incredibly important. It will literally change the way you deliver your practice. So come and get involved. That's why membership is really important.
Becoming a member will give you contacts, making great network connections.
You need to understand what's coming and you need to be a part of it.
Our fees are imperative. Without that, this association doesn't exist. And without this association, our profession is going to have a much harder time advocating.
The monies that OPA has are really focused on delivering value and making an impact for members.
It's still an expense, but think about more of a long-term investment into your future versus a short-term one.
As one person, we can actually only do so much. As a profession, I think we're unstoppable. And if we take all the individuals that are pushing the envelope and that are pushing ceilings, that are being creative, that are coming to the table, if we put all of us together, watch out. Watch out, Ontario.